Hi everyone! In today's video, we're going to talk about some gram-positive bacilli that can cause disease. And the three we're going to talk about belong to the genus Clostridia. You've probably heard of some of these before. You've been vaccinated against one of them, hopefully. So let's learn about how they cause disease. In general, our Clostridium species, all of the species belonging to the genus Clostridium, have several characteristics that they share. They are gram-positive. They are anaerobic organisms, so they do not require oxygen. They do not want oxygen in their environment, and they can form endospores. Endospore formation is important for these because it allows them to survive in high oxygen environments. These are commonly found in the soil and water. Again, why that endospore formation is important. It helps them survive in those areas. Two species that you've heard of, I'm sure, are Clostridium tetani and Clostridium perfringens. So we've talked about perfringens before in class. And both of these can be part of the normal gastrointestinal flora of various animals like cows and goats and horses. But there are in this genus several pathogenic species. Clostridium perfringens is histotoxic, which means it causes disease in our tissues, our skin and our muscles. Clostridium difficile, you've also heard of, I know. This one is enterotoxic. It causes gastrointestinal distress. You may not recognize C. difficile, but you probably recognize the name C. diff. That's this bacteria. Clostridium botulinum is neurotoxic, meaning it affects the neurons, as well as Clostridium tetani, also neurotoxic. The picture that you see here is a gram stain of these bacteria. So they are bacilli, and you can see some bacilli like this one here. And when they form endospores, those spores form on one end of the bacterial cell body. So if you look at this one that I'm circling with the laser pointer, you see this kind of club-shaped end. That's the endospore part. So these are often described as club-shaped or tennis racket-shaped, because they have what looks like a thin handle and then the head of a club or a racket there. Okay, so let's talk first about Clostridium tetani. Here's a picture of it with its bacilli and the drumstick, tennis racket, whatever you want to call it, shape on the end. And Clostridium tetani's main virulence factor is a toxin called tetanospasmin. This is encoded on a plasmid, and it results in what's called spastic paralysis. Spastic meaning the muscles cannot be relaxed. So a constant flexing and tightening of the muscles without relieving that flexing pressure. For a patient who is suffering from tetanus, it begins as what's called trismus, which is a tightening of the muscles of the jaw, and lockjaw, meaning the jaw cannot move. Our person is having a problem raising and lowering their jaw to talk or to eat. It does progress from there, and it moves down into the chest cavity, where our patient can experience contraction of the diaphragm, which, when you inhale, you're contracting the diaphragm to bring air into your lungs. When you relax your diaphragm, you exhale. In severe cases of tetanus, patients have the inability to exhale because they cannot relax the diaphragm. Now, as you can imagine, this is going to lead to suffocation. Now, as y'all know, most cases of tetanus come from some sort of wound infection. So we always hear things like, oh, someone stepped on a rusty nail or something like that, which is a pretty common way because the endospores of Clostridia are found in soil. But it doesn't have to be a rusty nail. It could be that a person has a cut that then gets dirt in it. Maybe it's a piece of glass that someone has cut themselves on that's found in the soil. There are different ways rather than just a rusty nail. Now, sometimes people won't have any symptoms at all. They'll be fine. Their body clears the infection. But usually within the 7 to 10 day incubation period, the patient will start to feel some sort of symptoms. So as these endospores become vegetative cells again, the tetanus toxin, tetanospasmin, is produced. It gets taken up into the nervous system. And the first set of symptoms that our patient will experience are general things like muscle aches, myalgia, meaning kind of discomfort and just feeling bad overall, but then trismus, that tightening of the jaw. A couple of days after the onset of those early symptoms, as more toxin is being produced and spread throughout the nervous system, our patient is going to experience more and more of that spastic paralysis. So it's preventing motor and autonomic nervous system functionality. This results in things like muscle spasms, and this can start out as localized, so muscle spasms in the neck, in the arms, in the back, and then it can become generalized where the whole body is spasming at once. As it becomes more severe, our patient can experience cardiovascular issues, so the heart is not working properly, having tachycardia or bradycardia, irregular heartbeats, because remember the heart is a muscle and it is innervated as well. And then in severe or fatal cases, increased respiratory rate, GI secretions, because all of the muscles are not functioning properly and our patient cannot control normal bodily function. Now, this can be fatal, especially if our patient is unable to breathe properly because they cannot relax the diaphragm. So our patient may need to be intubated or put into a coma to prevent these spasms from occurring. When these muscle spasms occur, the patient is alert. They are aware, they can feel how painful it is. It's not like in a seizure where a patient may be unconscious and not remember having the seizure. Tetanus patients remember all of the pain, they can feel all of the pain. Now, many people will recover from a tetanus infection, but it takes a very long time. It can take months for a patient to fully recover. So in the 4 to 6 weeks after those severe symptoms are beginning, what has to happen is the body needs to degrade the toxin and kill off all of the bacteria. And this can take a very long time. That toxin can be very, very long-lived. As the degradation of that toxin occurs, the spasms will stop, normal muscle tone and muscle functioning will return, and cardiovascular and autonomic control will come back. But that's months. And during this time, your patient is most likely going to be hospitalized to make sure that they are still breathing properly, that their heart rate is under control, and that they're not going to have any severe life-threatening complications of this infection. So how does this toxin work? How does it cause spastic paralysis? If you've taken anatomy and physiology, you hopefully remember this, but our nerves are innervated by motor neurons, and motor neurons receive stimuli from either stimulatory neurons or inhibitory neurons. So the stimulatory neurons tell our muscles to contract, and the inhibitory neurons tell them to relax. And this is done through the release of neurotransmitters. GABA and glycine are the two important ones for muscle relaxation. And in a normal muscle cell, what happens is that these little vesicles containing the neurotransmitters fuse with the membrane of our inhibitory neuron, release those little red neurotransmitters into the synaptic space, and those get taken up by the motor neurons, which then tell the muscles to relax. When tetanospasmin is present, these vesicles cannot attach to the membrane of the inhibitory neuron. So they're stuck there in the inhibitory neuron. They never get released. And so our motor neuron never has the chance to tell the muscles to relax. And again, tetanospasmin stays in a person's body for a very, very long time, and it takes weeks to degrade this and allow our patient to fully recover. This image is kind of disturbing, but it shows a patient with tetanus, and when all the muscles of the body are contracting at the same time, your back muscles, which are pretty strong, will contract. So in severe cases, our patients have this bowed posture. Fortunately, there aren't a whole lot of cases of tetanus in the United States. There were 264 cases reported between 2009 and 2017. And this is because we have a really effective vaccine against tetanus. 25% of those cases were in people aged 65 or older. And the reason for this is, like we've kind of talked about before, as you get older, your immunity wanes. So even those diseases that you've been vaccinated against, your immune system does not do as well to recognize and get rid of them. But also because we need a booster for our tetanus vaccine every 10 years. And as you age, you're less likely to continue getting those vaccines. So our elderly population, their immunity may have waned because they need a booster and they haven't gotten it. We can diagnose tetanus pretty easily, particularly if a physician knows what to look for. So those characteristic muscle contractions, trismus, what's called a sardonic smile, as all of the muscles in the face contract. I want you to try it. Try contracting all the muscles in your face, and you get this very strange smile happening. So that can be a diagnostic characteristic in looking at a patient. However, because we don't have a lot of cases in the United States, it can be easy to misdiagnose this, particularly if a patient doesn't report having done something like step on a rusty nail or cut their foot or anything like that. Bacteria are very rarely isolated from tetanus cases. Again, this is because it is sensitive to oxygen, so we have to grow the bacteria in an anoxic environment, but also they just grow really, really slowly. And if something takes, 4 or 5 weeks to grow up, that's not the best way to go about trying to diagnose a patient. Now, fortunately, tetanus does not have to be fatal. We have pretty good treatments for tetanus patients. The first is what we call passive immunization. In this instant, what will happen is the patient will be given antitoxin antibodies, so antibodies that bind to the toxin and prevent it from acting. It's called passive immunization because your body is not making its own antibodies to the toxin, but you're getting them from another source. This is similar, as a sidebar, this is similar to the antibody cocktail that they're using for COVID-19 that's created by the company Regeneron. So that's passive immunization, does not boost your immune system. It just helps your body get rid of what's already present. So we'll use that to neutralize the toxins and help prevent those muscle spasms. And additionally, treat with an antibiotic because we want to get rid of any bacteria that are in there so that they're not going to continue to make toxins. If a person has tetanus, we can give them active immunization. So we can deliver tetanus toxoid, which is a derivative of the toxin that doesn't have that spastic paralysis effect. And what this will do is force the body to make its own antibodies to help neutralize the toxin. So that's active immunization. We're making the body make its own immune response rather than passive immunization, which is giving it immune response from an external source. And then the big one to help people recover is supportive measures. If our person is starting to experience respiratory distress, we might want to intubate them, have them on a breathing machine because they can't move their diaphragm. Because these patients are experiencing the pain of these muscle spasms, they can be put into a medically induced coma so that they don't have to experience that, and it will help their body recover. If a patient comes in and they're at the state of total body paralysis, where it's just a constant spasm and they cannot relax even for a short amount of time, it's really too late to do anything for these patients. And of course, the best thing to do is to prevent a disease before it starts. With tetanus, we're fortunate. We have this really good immunization technique. It is that tetanus toxoid vaccine. The CDC recommends that there are 5 doses given to children beginning at 2 months of age, spread out over the course of several years, and then a booster every 10 years for life. But that's one that you should always keep up on and check with your doctor to see if you need a booster. Okay, next up is Clostridium botulinum, and you have probably heard of botulinum before. It is what we call an intoxication. For the case of botulinum, you don't need the actual bacteria present, just the toxin. The interesting thing about botulinum toxin is that it is the most potent toxin that we know of. It is very, very lethal. Someone somewhere did the math to figure out that an LD50, a lethal dose necessary to kill 50% of your test subjects, is 1 nanogram of toxin per kilogram of body weight. And then they figured out that if you aerosolized 700 grams of this toxin, aerosolized it, put it into air vents, spread it around the world, that would wipe out the entire world's population. Now, botulinum, or botulism as the disease is called, is mostly associated with things like home canned food that has been improperly processed and honey. So we see this more often in infants. Now, even if you don't can your food at home, if you go to the grocery store and you buy canned goods, if they're bulging, like you can see here, this could indicate the presence of Clostridium botulinum. Don't eat this, just throw it away. It's not worth risking your life. The reason that we can still get botulism from foods that have been canned and processed, which if you've ever canned food before, you have to boil it in a water bath and seal it off. It's those endospores. Boiling and heating will not kill the endospores, and because they're anaerobic, If you seal them in an anaerobic environment, those endospores can then become vegetative cells again and start producing botulinum toxin in this can of food. Honey is the other place where we sometimes see botulism, particularly raw, unprocessed honey. And that's one of the reasons that we say not to give honey to young children and infants, because the very low concentration of botulism toxin in there can still be detrimental to those infants. Now, Clostridium botulinum can actually cause 3 different types of disease, whereas tetanus just caused the one. The first is the most common, which is foodborne botulism. And the symptoms for this begin with pretty non-specific things: dry mouth, nausea, diarrhea, things you might experience with any sort of foodborne illness. But it progresses pretty quickly to weakness, so muscle weakness, dizziness, blurred vision, and then will progress on eventually to paralysis. So one of the things people report early on is that they're having vision issues and they're having trouble swallowing. In infant botulism, again, that's usually from contaminated honey, the symptoms are very different. Rather than nausea and diarrhea, infants experience constipation and general fussiness, followed by failure to thrive, which means lethargy, not gaining weight, not carrying out normal baby activities. And then the third is wound botulism. And like its name suggests, this is when an open wound becomes contaminated with botulism endospores, similar to how a person would contract tetanus. In this case, however, the symptoms become similar to foodborne botulism. It's just not ingested, it's delivered into the body in a different way. Now, botulism is essentially the opposite of tetanus. In botulism, our patient is going to suffer from what's called flaccid paralysis rather than spastic paralysis. So spastic was a constant tightening of the muscles. Flaccid paralysis is inability to contract the muscles. And you can see that in the image of our baby here, where there's no muscle tone. The limbs are just hanging loosely as the baby is picked up. They can't even hold their head up. It's just swinging back like this because of the inability to contract muscles. So all 3 types of botulism, whether it's ingested, whether it's infant or wound botulism, result in progressive symmetric flaccid paralysis. The toxin gets absorbed into the bloodstream and it affects the motor and autonomic nerves, just like tetanus toxin did. If it's left untreated, it will progress like this. It will start with ocular, laryngeal, and respiratory muscles. So vision disturbances, difficulty breathing, a hard time swallowing. It then spreads down to the trunk, just like tetanus did, where it can result in respiratory paralysis. And this is the most common cause of death in infant botulism. In this case, rather than not being able to release the diaphragm, our patient has trouble moving the diaphragm to inflate the lung. As I said, botulism is kind of the opposite of tetanus, and we see that it works the opposite way on those motor and autonomic neurons. So again, here's our muscle cell that's innervated by neurons. And at that normal synaptic space, our vesicles here and our stimulatory neurons contain a neurotransmitter called acetylcholine. These vesicles dock with the membrane of our stimulatory neuron, release that acetylcholine into the synaptic cleft, and it tells our motor neurons to make the muscle cells contract. Botulism toxin uses the same techniques that tetanus toxin does, and it prevents these vesicles with acetylcholine from fusing with the membrane of our stimulatory neurons. So now we're not getting release of acetylcholine, and our muscles, our motor neurons, never tell our muscles to contract. So we get flaccid paralysis because they don't get the signal that tells the muscles to contract. So while this is a really potent toxin and it can cause death, we have also found a number of uses for it outside of disease. You've probably heard of Botox. This is botulism toxin that's injected into skin to smooth it out and decrease the appearance of wrinkles, which is a purely cosmetic and unnecessary treatment. But there have been a number of other uses that actually have medical relevance. The toxin is injected into the head and neck for treatment of migraines. This was approved in 2010. And you may have heard of other uses. I'll give you a couple of examples. People who have constant muscle spasms, like in their back, we can inject botulism toxin into those muscles and it will relieve the pain and discomfort of those muscle spasms. Another really interesting one is that it can affect sweat glands. So people who are really embarrassed and have issues like really sweaty palms or feet or even armpits can have botulism toxin injected in those spaces, and it will decrease the amount of sweat that they produce. So a couple of really interesting uses for what is considered a deadly toxin in ways that are safe and actually have positive benefits to human health. Diagnosis of botulism, kind of like tetanus, it's mostly the symptoms that are going to tell us what our person has had. We can, again, culture the organism from food. So if a person has eaten home canned food of some sort, if they bring that in, we can try to culture the organism from that, from a person's feces, because it'll be shed in their feces, or from a wound if it's wound botulism. But again, these are slow growers, they're anaerobic, so they're tricky to grow in the lab. Treatment here is similar to treatment for tetanus. Mechanical ventilation would be very, very important to make sure our patient is still able to breathe in and out, because remember, they cannot contract the diaphragm to bring in air. We can use an antitoxin to neutralize the toxin in the blood, prevent it from acting on those neurons. And then we can use antibiotics and antimicrobial drugs in the instance of wound botulism only to get it out of that wound. These drugs are not effective for foodborne botulism. They don't make a difference, so we're not going to prescribe them. And like we've all heard before, prevention is better than treatment. If a person likes to can their own vegetables from their garden at home, making sure that they're using proper canning techniques to prevent contamination of their food. The toxin itself can be destroyed by heating it to at least 80 Celsius for about 20 minutes or more, which is a pretty long time and a pretty high temperature, but that will destroy the toxin and make food safe to ingest. And again, infants under the age of 1 should not consume honey, because it may have trace amounts of botulinum toxin in it that wouldn't be harmful to adults, but will be harmful to infants. And the final Clostridium species, Clostridium perfringens. We've talked about this one a little bit before. We're going to recap it here. Here's our picture of Clostridium perfringens taken from a wound where we have these red epithelial cells and our purple gram-positive bacilli. There are 5 different strains of Clostridium perfringens. They are very cleverly named A through E, right? Because microbiologists are not great at naming things. They produce hyaluronidase, and their grouping into different strains is based on the toxins that they produce. So there are 11 different toxins that can be made. We're not going to go through all of them. Some strains produce different varieties of them. Alpha toxin is the most potent. It is a phospholipase. So it breaks down these molecules lecithin and sphingomyelin, which are in the cell membranes of a variety of cell types. And this causes the formation of pores in those cell membranes, which is going to outright kill cells and cause tissue destruction. Theta toxin is one of the other very important toxins. This one actually alters capillary permeability. So it makes the capillaries, our blood vessels, more leaky. And it's also toxic to heart muscles if it makes its way through the bloodstream to the heart. A few strains, but not many, produce enterotoxins, which again are going to cause gastrointestinal distress. Like alpha toxin, these are pore-forming toxins. And as they form pores in those gastrointestinal cells, it leads to calcium leaking into the lumen of the intestine, followed by loss of fluid and diarrhea. I apologize for these gross pictures. Cover up the side of your screen if you don't want to look at them. But Clostridium perfringens can cause 2 main diseases. The first is food poisoning, right, if it's ingested. This is pretty similar to other types of diarrheal diseases we've talked about. Abdominal cramps, watery diarrhea. There's no fever or vomiting associated with Clostridium perfringens food poisoning, though, so it's a little bit different from what we may see with E. coli or Salmonella. And then the big one that we've mentioned before is gas gangrene. This occurs when a person has experienced some sort of trauma to their body or by the parenteral route. We can determine gas gangrene by seeing these necrotic black tissue and the gas bubbles that you can see in the patient here. So again, Clostridium perfringens expresses hyaluronidase and collagenase. And I want you to pause and think for a minute about what do those do and how do they help this bacteria. And they can cause tissue necrosis, right? That's the black stuff that we see here. Which of those toxins that I mentioned could be causing tissue necrosis and death to tissues? And then these foul smelling gaseous bubbles. So if a patient came in with a leg that looked like this, with these bubbles full of gas, there's a very distinct smell that the stench alone can be diagnostic for gas gangrene. What might be causing the gas and the smell? Clostridium perfringens diseases can be diagnosed fairly easily. Generally, there needs to be a high number of bacteria in ingested food. So if you have some of that food around still, we should be able to find bacteria in it. And we can also look for bacteria in the feces of our infected patient. With gas gangrene, again, that clinical presentation, what your patient looks like, the smell of the gas, is enough to diagnose disease. Treatment options, if it's food poisoning, it's generally self-limited, like we see with Salmonella and Shigella. For gas gangrene, however, it is much more involved. First thing that will need to be done is debridement of the dead tissue. So any of that necrotic black tissue needs to be removed because it has bacteria in it, and it's going to cause hypoxia of underlying tissues. In addition to debridement of tissues, our patient is going to get large doses of antitoxins to neutralize any of the toxins that the strain makes, so our alpha toxin and our theta toxin, and we're going to give them a hefty dose of penicillin to kill any vegetative cells that are in the body. We want to get rid of those cells to prevent them from making more toxin. However, for Clostridium perfringens, prevention is quite difficult, and so I want you to think about why that might be the case, and we'll discuss that in class. The best thing that we can do is if you get a wound, you have any sort of trauma, cuts on your arms, your legs, wherever, clean them properly with soap and water, disinfect them, and don't just leave a wound to get contaminated. So I want to leave you with one last question to think about, and we'll discuss this in class when we come back. How could you clinically, based on appearance in a doctor's office, differentiate between gas gangrene caused by C. perfringens and necrotizing fasciitis caused by group A strep?